Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting with you live from the Dolph Simons Family Studio. Hawkeye is on my right, back again. We're on our 100th and something show. We'll be delighted when the show ends because it means coronavirus has been taken care of.
That's right.
But in the meantime, we are with you, and we're looking forward to visiting with you today. On my left is Steve Lauer. Steve Lauer is a pediatrician here at KU. He's also the Vice Chair of Pediatrics, and he is a good friend, a great colleague, and an outstanding physician. And we're going to be talking a little bit today about what's going on out there with coronavirus, and I'm sure we're going to have a lot of questions about schools because, man, that's a hot topic, and it changes constantly. We're hoping to link up with David Smith. David is our medical director of sports medicine, especially for our youth, and by that I mean high schools and junior high, et cetera. Had a little bit of audio trouble. We'll check and see if we can pull him in. We have a really special guest today, and that person is Emmy. Emmy is a freshman headed to KU to become a school teacher. And we're going to turn to Emmy in just a moment, but first, Hawkeye, I think the numbers are...
They're looking pretty good.
They're better today. Yeah, we just got off a CMO call. Everybody's census was down. Well, not everybody, but the trend was down. A few were up, but most were down overall. So
yeah, 23 in the hospital with 7 in the ICU and 3 on the ventilator. So that's
much better. We were at 6 on the ventilator.
Yeah. So we've done pretty well. Now we should also say that we do have 23 in the hospital still from COVID that we don't count acutely as COVID disease because they have met the criteria that if they were otherwise out in the community, they'd be okay for being in the community. They've met our criteria for discontinuation of certain isolation precautions.
And we say our criteria. They're really HHS's criteria.
They are,
so we're just following the letter of the law and reporting. So we're going to try and do this today. We're no mean to confuse you, but on a regular basis, we'll tell you, here's how many we have that meet the acute definition of COVID, and here are those who are COVID recovering but still in the hospital and no longer have to be in the same kind of isolation precautions as some of the other folks.
Yep, and even those numbers have improved because I think we had 26 yesterday, so we've had some discharges from that group who was finally able to get home, which is a great thing.
Yeah, okay. So, Steve Lauer, how are things over in the pediatrics clinic?
We're doing fine. I think we're really back up to our normal amount of patients coming in. Families have done a great job of getting back in, getting caught up on the well visits, and especially getting caught up on vaccinations. So while there's still a lot of concern from people about being in clinic, with the changes the system has made about getting clinics safer, I think families are more comfortable getting in and getting caught up.
Yeah, that is a good thing.
Yes,
we need them to do that. The flu shots are coming out, so your advice is?
Get your flu shot.
Yeah. All right.
Find out, as soon as those are available here, there'll be lots of announcements about it, where to get them, and as much availability as we can generate for that. But it's more important than any previous year that everybody get their flu shot this year.
Yeah, it sure is. And even though we may all have a little bit of cows, just to coin talk about my new cool phrase, COVID weariness syndrome. That's cows.
Okay.
Yeah.
All right. Yes.
Just to talk about that again today as I try to popularize that and see if it'll go viral. No pun intended. No pun intended. Work with me, people. I want to make sure. So, right. Emmy, let's turn to you for just a minute. You are headed to be a teacher at KU, but you've had a recent experience that I think our folks out there need to hear.
So I, over the summer, I did have COVID, and, it really wasn't horrible at all. At some days it felt like a very mild flu. The very first symptom I got was a sore throat, and I really didn't think anything of it because I also had mono this past year, and so I get tonsillitis all the time now. And so, but right as I felt it, I kind of got nervous. So I just started staying away from people, started quarantining until I felt better. But I just decided it'd probably be a good idea to get tested. And I did, and I had it. And then, so I just stayed in my room for about 10 days, and then I tested negative.
Good deal. Now, are you headed to KU today? Have you already done the move-in thing, and have you been tested at KU with the saliva test already?
So actually, I was supposed to move in August 9th, but now I'm moving in tomorrow because during the time I had COVID, I obviously can't move in. But on the 20th, so tomorrow when I move in, they will do the saliva test for me, and then I'll get my results back within 3 days.
All right, that's really good. And I think that's the one thing we're trying to do to help keep KU safe. We said it's a mass migration of 20 to 25,000 people, plus the staff and the faculty, into this community of 80 or 85,000. Holy cow, that could be a big deal. So we're going to test everybody, and if you're positive, you have to go back home in quarantine. If you can't get back home, Naismith Hall has been repurposed for being a COVID dorm, so to speak. And so we're trying to do our best to see if we can keep KU up, open, and going, and because we want to make sure we beat the Tar Heels. I think that's the Jayhawks beat Tar Heels once again.
And the Blue Devils, too.
And the Blue Devils, and Notre Dame, and everybody else. Let's go, Rock Chalk. Okay, so Emmy, talk to us a little bit. What advice do you have for people your age? Because, I see those pictures, and I see old folks, too, my age, not wearing a mask. Drives me crazy. But I see all the young people not wearing a mask. I think, oh, gosh, they feel invulnerable. And then I look around our hospital, I see these 20-year-olds hospitalized, and I think they just don't know. So what's the advice you have?
Well, just like based on statistics, it is very hard for us to be in the percentile where we do get it pretty bad. And I think that's kind of everybody's mindset. That's a kid my age or going to college or going into high school. They're not really very worried. And I would just say we all want to stay in school. I sadly got part of my senior year taken from me, and I really don't want that to affect my freshman year of college. And I know I can probably speak for everyone else. Everybody wants to be in school. Like those 7 months where we weren't in school really took a toll on all of us, I think. And I would just say, wear a mask when you go into stores. This is I'm not trying to make anything political here. It's just the courtesy of other people. And if we just do that, we can, try and be in school, which is what everybody really wants.
Yeah, wear a mask, wear a mask, wear a mask, wear a mask. It's not political. It's just health. And we try to depoliticize it because people try to it's a political statement. No. Freedom with responsibility, folks. Wearing a mask is keeping each other safe. And I would say, hopefully, you'll be wearing it everywhere on the campus as well. I think that is the recommendation officially.
Even walking around.
Exactly. And the dorm rooms is important because that's kind of more of a crowded situation. And so make sure you do that and make sure that if you see somebody, say to them, hey, have you listened to Doc Hawk or Goofy Stites? Because they're really telling people to wear a mask. Maybe you should tune into the morning show and they can hear our advice. So David, as we look at you, and just quote it. We're happy to come up. We did a video for the Lawrence campus too. We're happy to do one for any time because we can stand up and act silly anytime, and it's what I'm best at. And Hawkeye's a little straighter than I am, a little better than I am, but we can pull in a lot of other people who want to. And we can even pull the chancellor in.
Yeah.
David Smith, how are things out there for athletics? Lots of changes, man. The schools, like Shawnee Mission says, they're not going to open. They're going to go online. They're not going to open up in-person classes. What's all this mean for fall sports?
Well, you know what, Steve? I'm on a roller coaster. 2 weeks ago, I was very encouraged. Last week, I was discouraged. Then I got encouraged again. And literally in the last 24 to 48 hours, there's been a lot of information coming in from the school districts as they weigh in on what they're going to do. I won't speak about going back to school, but I will speak about going back to sports and exercise. And I appreciate Emily's comments, Emily, because that's the word on the street from the student athletes is, please, let us do something. Some kind of sport and activity is so healthy for us physically and emotionally. And so, as you heard yesterday, the Shawnee Mission School District has chosen to, at the end of the week, shut down their sports and activity again while they go through what the next step will be. Blue Valley High School District had a late meeting last night, and they rescinded the gating theory of how to get back into school and sports, and they'll be weighing in on what their next step is. And then I've heard from other districts, not just in the Kansas City area, but because of my role on our Sports Medicine Advisory Committee through Kansas State High School Athletic Association, they're dealing with this statewide with different counties and sports and activity. So Johnson County is Johnson County, but across the state, a lot of schools are still starting and activities are still starting. So it is a roller coaster. I still believe firmly that we can start activities and we can do it safely if we have Emily's philosophy that we have to just pay attention to what we've been saying for months. We can reduce the risk by doing very simple things. And then I go back to our experience through the summer with sports and activity as they started conditioning. And you know, there are just not reported cases coming from the fields. They're coming from the social situations. And so how do you control that? We're trying awfully hard at the pro level. It's working in some circumstances, some not. They're trying awfully hard in the college level, and some conferences have chosen to shut, and some not. And now it's the high school and middle school's chance to shine. And I'm really hoping that we at the lower levels of youth activity can prove to the pros that we can do it. So that's my summary.
All right, well, good luck with that, too. And I think to that point, Dana, our KU athletes have been, after the initial few bumps, they've worked really hard and stayed safe. So, Rock Chalk, let's talk about that.
Absolutely. We have had good buy-in and acceptance of the guidance that we've given for infection prevention and control from the administrators on down to the players, the coaches. It has gotten better. Some are better than others. You know, we need to continue to endorse this. It is new for everybody, but they have really been accepting of it and have really made strides even from the first day we stepped on campus to go monitor, because we are sending Amanda Gartner and Lance Williamson out there to monitor and really look and be the boots on the ground to see that those sports programs are doing everything correctly.
And I think Mizzou has too, so M-I-Z-Z-O-U. You know I'm a Tiger Hawk because I've been to both Mizzou and KU. Don't shake your head. Oh, man. It is possible to be a Tiger Hawk in the Kansas City Metropolitan, especially since Mizzou went out and did SEC stuff. All right. Jill, what questions? Any questions out there from media? All right, we're going to jump right to our listening audience.
Well, before we do that, can you say goodbye to Emmy, because she has
to go.
She needs to get prepared for Rush. Ask her what she's going to school for.
Emmy, what are you going to go to school to do?
Elementary education and special ed.
Oh, my. So, Emmy, there's a lot of controversy around that. So, you know, hats off to you for taking that on. My sister was a school teacher. My mother-in-law is a school teacher. What a great thing. And elementary ed especially. That's awesome.
Yeah.
Here's my advice to you. I'm going to be a doctor dad for just a minute, okay? Here it is. You ready? If you've had mono and then you had COVID, you got to make sure you get a flu shot. Make sure you wear a mask. Take really good care of yourself. Get some sleep. Get rest a little bit. Just be good out there, because that's what I would tell if you were my patient. So just saying.
Oh, for sure. Yeah, I don't want to get sick anymore. It's not fun at all.
Oh, it's not fun. And hopefully you'll make sure you get that rest and eat healthy and do well. Are you going to do the Rush thing?
Yes, we actually start today.
Right. How are they doing that? Because I don't know. Rushing in person may not be the best plan.
No, it's all online. So I'm at home. I'm not at KU yet. I move in the 21st. I actually start living there the 21st. And, yeah, it's all on Zoom and everything. And it's actually going really well. So
awesome. Well, it's kind of like that Aretha Franklin song, right?
Which one?
Who's zooming who?
Okay.
Sure. A little bit before her
I'm
time.
not going to sing anymore. Maybe she's heard it. I don't know. Well, Emmy, good luck. Thank you very much for being with our program today. It's a delight to have you on. Good luck, and you're obviously welcome to stay on as long as you want. I'm going to have to listen to some. We're going to now take some questions from our
thank you so much for having me.
Good luck to you. Stay safe out there. Make sure everybody around you wears a mask. Maintain social distancing, cough into your elbow. Don't touch things you don't have to. Wash your hands frequently. And, shelter in place whenever you can. Stay 6 feet away.
Don't meet in large groups.
No large groups. No large groups, right? No large groups. Make sure you know who's in your bubble. Nothing else, though. I'm sure your parents told you all those things, too. Okay.
All right, we have questions. Judy wants to know that the gated requirements for returning to schools is based on positive percentages of tests, but they vary sometimes online from Johnson County to what the KDHE might say. Can people speak to the difference?
We'll do our best.
Yeah, we'll do our best.
Okay, Hawkeye, I want to hear the medical explanation for the difference.
So we know that KDHE, on their main website, will just say the percent of positives in the state. There are other county positive websites as well, our county websites that will have their percent of positive tests, and they will report what that is. And the ultimate goal is getting to do as many tests as possible, to have access to tests so that everybody can get tested, theoretically once a day even. So as you're building up that increase in testing, your percent positives will go down. That means you are actively out there looking for new cases, and that's the most important thing. Right now, we understand that certainly depending on what county you are in, just as you had talked about, there are different rates. Some of it is higher than the overall statewide rate of, I believe, around 9%. But, again, that has to do with a lot of different factors. The biggest one is we want to continue to be able to have people have access to do as many tests as possible, to go out there look for active disease so that those people can be quarantined, isolated, so that we can really stop the spread. But that's the biggest issue, is the different counties will have different rates of positivity throughout this whole thing.
And I think even different school districts can do that, because they can look at the
Yep.
literature and
They
then
have
decide
gating.
which one they want. And that's,
Yeah.
when Dr. Burks was here on Saturday, that's one of the things she pointed out. And you'll remember Dr. Burks is the head of the Trump administration's coronavirus task force. She's a brilliant woman, just a brilliant person, and does a great job. She's fought AIDS internationally, and she has an amazing track record. And one of the things she pointed out was that in the United States, the strengths obviously is freedom. One of the challenges is when things come from the federal government and go down, they get filtered at varying levels, and so every state and every county and different states often have their own ability to do things, which is exactly what's going on here in Kansas. So thoughts about the different percentages between schools, Steve?
Well, I think it's just, say the problem is, I think that there's just not enough testing out there. It's hard to understand exactly what the true community rates are right now, and so that each school district, health department is going with the best information they can get and trying to make those safe decisions. So, you're going to see different numbers at different times on different days. These websites refresh at different rates. So, taking a snapshot at certain times is really hard, I think, sometimes to understand exactly where all these things come from. But as they go forward, and hopefully there's more testing, more understanding of the community rates of this infection, they can make better informed decisions.
Yeah, I think that's right. And David, you referenced a little bit about some of the different rates and how Shawnee Mission was approaching theirs last night as they looked at this question. Any other follow-up comments about that?
Yeah, each district obviously has tremendous professionals that have to weigh in on all these decisions, and we can't, as medical providers, make the decision for them. They have so many other factors that they have to deal with. One of the things, though, that when people ask me, I say, let's be careful and not just keep going with percentages. That's very, very important information. But we're kind of sometimes digressing away from some of the things we know, too, about mental health issues. There's a lot of data out there about what the impact of shutting down school and sports and activities for youth when it comes to mental health, anxiety, depression, suicide. In fact, I was looking at CDC data out of June, a big study over 5,000, that showed that 30% of people reported anxiety and depression. And the really sad thing was 13% reported turning to substance use to try to get through the stressors. And 11%, this is now all age groups, but 11% had suicidal ideations. If you boil that down to the I think it was 18 to 25-year-old age group, they reported that 25% had suicidal ideations. What does that mean to our adolescents? I don't know. But like Emmy said, it's an impact on, I call it the vulnerable population now, our youth. And I think we need to keep coming back to that too and paying attention as we look at gating theory, which is a theory based on percentages. So that's our message across the state, is what is the importance to students and athletes. I don't want to just say the athletic population, but students in general, is let's keep it, pay attention to the mental health aspects.
Yeah, it is important. We know that early on in the pandemic, our suicide hotline was up over 8,000%. When I talk about COVID wariness syndrome, I gave it a funny name, just to, cows, just so we can kind of put some humor into the COVID pandemic. But the reality is it's not humorous. It's actually really real, and I think people do grow weary. Jill.
All right, so Donna wants to know, with school districts making their own calls, what would you tell them to guide their actions if they're going to be in class And how do you advise the parents of your patients?
Okay,
Do they
Steve.
ask you, should I let my kid go to school?
Well, frankly, I try to ask them first and ask what it is they've decided. And the reality is that there is no universal answer to this. There is no good answer for that fits every family. Some families may be able to take on the at-home teaching of their children, but lots of families with both parents working or lots of other services that come from the schools really may not be in a position where they can easily take on that task at home. So I think each family has to be making that decision for themselves based on their particular situation. And in that setting, there really isn't a wrong answer. It's got to fit what that family needs. I do think there's the thing about the educational part of this. And some of these studies show that kids last year, depending on the school district, lost anywhere from 3 months to essentially the entire school year of their educational value. And if we get into a situation where that continues for another year, we have some really serious educational challenges in this country that are going to be incredibly difficult to get over. So it's all, there's risk and benefits on everything. If they're going to go back to school, we're going to go back to the same things: 6 feet apart, wear a mask, wash your hands, try and keep those kids cohorted however they can so that the spread of this virus through schools will be minimized, and the students and the teachers and all those people they're going back home to are well protected.
You know, I always like to comment on this question, but Steve, I don't think I could. That was the great answer. Don't you think? Anything else you would add?
No, I
It's
think
perfect.
We've been practicing, so
Yeah, well done.
Yeah.
You mean it comes up 27,000 times a day?
pretty much.
Mary is curious that the COVID patients that we care for, do they often know where they caught COVID? Or
Yeah,
is it a mystery to them?
I think, Dana, most people do. They can
Yeah.
kind of identify
Yeah.
it because they know that one time when they went into a large group or they did this one, and it's all about that. It's really not what happens inside your bubble. People are really safe inside their
Yeah.
bubbles. It's when they venture outside of their bubbles and they do the things they're not supposed to. I went to a bar. I went to a restaurant.
Yep.
I was in a big gathering for this. I would get a big gathering of that. And it's all about those big things because your chances go up exponentially when you go into a crowded area, especially if it's indoors, Dana.
Yeah, there are people who have done nothing that continue to get it. There was a patient I saw who was excellent about the bubble, and the spouse was excellent about the bubble, but the spouse went out to the grocery store, and this patient had it. There was another patient who, and this was early in the season, who went to a bar and then got contacted, 3 or 4 days later, hey, I have COVID, so that patient ended up getting it. I know there was a patient that went to Mississippi for a family thing, and there was a contact there from another area who had got it. And so I think most of the people that I have seen certainly understand where they have gotten it, especially early in the pandemic, say April, March, May, June, early time. Now there is a lot of community spread, but I would agree with you. I think most people at this point in time probably know where they had come into contact with it.
Yeah, and I think it's that same thing. It's about that community spread that occurs when you're around people.
Yeah.
And that's why you just have to be just so darn careful. And it's all about maintaining your distance and keeping yourself 6 feet apart. And we looked at the Chiefs thing and said, gosh, was this a good plan or not a good plan? And our advice is the same whether if you want to go to a Chiefs game or anything else. Because we visit with the Chiefs about it, and our advice is clear. You got to be at least 6 feet apart and have a mask on all the time. I don't care if you're in your parking lot, in your car, and you better know who's inside your bubble when you're inside the stadium. And if you're going to scream with the mask on, because the problem is that's when you're going to project the most secretions. And so don't take a mouthful of hot dog and then start screaming.
All right. This person wants to
Go
be
Chiefs. I do want to say go Chiefs.
Yeah, that's right. This person wants to remain anonymous, but they want to know if players or coaches on a team test positive and have practiced within the infectious period, is there a recommended guideline for when to return to practice or play for the rest of the team, and your thoughts about heart damage, potential for heart damage?
Okay, great. Two great questions.
Two great
David,
questions.
let's turn to you first, and I'm sure we'll all have something to say about this one. So, Yeah, when somebody's
Yeah.
positive
Yeah.
on a team, what happens with that person? What happens with the coaches and the other players on the team?
Yeah, we do the same type of internal contact tracing within that team, and there are so many safeguards at the professional level, as well as the ability to test. So yes, we have protocols in place for the Royals and the Chiefs, and there's a difference between quarantining and isolating, but it's a method. I can't share the details because some of it's confidential within our pro teams, and yet it's pretty straightforward. And as I started to comment earlier, remember the previous question was where they're finding out they're getting it. It's not within the team, it's from outside, and that's from pro all the way down to college and high school. So the myocarditis, we'll get to that. I think I'll stop on what happens within team sports. So far, we've been very fortunate with the Royals. I mean, you'll hear all across the nation different MLB teams, but we have been very fortunate with the Royals and have had very few cases, and thankfully, minimally, no major problems, some minimal symptoms. And then we go through the protocol, and we bring them back, and we watch them carefully as they get back out on the field. And yes, we have some screening that we do before they start exercising and as they exercise to make sure that their hearts are safe. And I think I'll stop so others can comment before we get to the myocarditis risk, which was discussed very, very well last week by Dr. Tim Beaver, our sports cardiologist.
I think that's right, and we can talk a little bit about that, but also I think to David's point, gosh, it's not really the team activity. It's when they leave and go outside in the public. And if you look at what happened with the Cardinals and the Marlins, it wasn't the team activity. It's what happened when they stepped outside of that.
Right.
And then you watch the reaction of the Cleveland Indians when a couple of players decided to go off the team. They're like, "You're going home. Get out," because you stepped outside and you put everybody else at risk. And it's that type of thing that will keep baseball going, which I do love. Let's go Royals, and I've watched almost every game, or at least had it on while I was working. I think that's the key, Dana.
Yeah.
And that's also what we're doing for the University of Kansas. That's the same preach, and you've been on those calls a lot.
Yep, but despite where they got it, where this teammate got it, what happens when they are in that group setting?
Yeah, when they bring it back.
Are you in the dugout where it's a pretty small area? Are you on the bench? What is the dynamics within that practice? So that really matters. That is important for contact tracing because you then are looking at potentially several members or half the team out for quarantine.
And that's what we saw happen in MLB.
Yep. And then once you are out in quarantine, especially if you're a youth athlete, the people in that household need to take considerations to keep themselves healthy and do as much quarantine away from that person as much as possible, as much as it's allowed in the household. So that's very important because then you can see how community spread can exponentially expand, and that's what we can see potentially.
And that's why we worked so hard, and we tested Royals or the Jayhawks 2 to 3 times a lot.
And they really, after that initial group, just as you said, the players were really on board, started to really do the right things. And
they police themselves.
They have, absolutely.
They've done a great job, and I think it's that. Gosh, if we could do as well as our sports teams in society, we would shut COVID down, right? We would shut it down if everybody could do as well as some of our sports teams. David?
Yeah, the players and the coaches have bought into this. It is amazing. And I'll comment on the high school coaches, too. I'm aware of several high schools that, in talking to their athletes and their parents, they say these coaches are all over it. These coaches want our youth to play. They quoted a prominent high school coach on the Missouri side who himself has some risk factors, but he said it is so important for our athletes to be able to get back to activity. He is 100% in, but they play by the rules, and that's what we need the rest of the society to do.
Yeah. Okay. So let's talk about myocarditis for just a moment. So I think, I think we did have a great program on it. Tim Beaver did a great job. We've been working closely with the NCAA, the Big 12, and other groups to try and establish a return to play protocol after COVID-19. What I can tell you for the KU protocols, it involves obviously a symptom screen, an EKG, a blood test, and then an echocardiogram and graded exercise as you return to make sure that you don't have symptoms. If any of those things go awry, then you have to have a cardiac MRI, and that helps us identify the risk of myocarditis. Is that all the right thing to do? what we've said last week and what we would, I think, still say is we don't know if it's safe because we just don't know that much about COVID yet. And that's our challenge. We don't know if it's safe. We think it probably is. You know, the athletes, especially if they've done some graded exercise and been supervised, we think they're doing pretty well. Yeah. But, you know, there's just, as we figured out with this darn thing, we're continuing to build the airplane while we fly it. It means that you don't always know, that's all I've said before, you got to know what you don't know. And so we can't say to you that it is safe. We can't tell you that it's not safe. We can just tell you that we don't know yet. So, David, thoughts about that?
Yeah, that's exactly right, because obviously across the city and across the state, we don't have access, sometimes even access to physicians to get these athletes in as they struggle with COVID symptomatically or asymptomatically after they test positive. So to require those tests you just commented on, Steve, with the EKG and the troponin and the echo and the cardiac MRI, we can't do that. But we sure can watch their return to activity over 2 weeks. And I'd like to hear what Dr. Lauer will be doing on the front line as a pediatrician. Yet, you know, we need everybody educated on this. This is significant stuff. I mean, but myocarditis was present pre-COVID. We had this way back in the day with different viruses. We still have it to this day with other viruses. So anybody coming back from illness needs to slowly ramp up their exercise again. And not everybody needs all the tests. Just because the pros may be doing some of that doesn't mean we have to do it at all levels. But I feel bad for the frontline physicians like the pediatricians and family docs, because they will be asked these questions. They'll have to get people in. And then it's going to be, Steve, I love your comment, we just don't know sometimes. So let's be super smart and guide them back into activity. And so, Dr. Lauer, I'd turn it to you and see what you're going to be doing as a pediatrician.
Good points on this are that, again, what would we have done in previous years when lots of other viruses had these same kind of symptoms associated with them? There's obviously heightened awareness and lots more of the disease around right now, but I agree we're going to be you know, how do you safely get them back in? Making sure we know that they were actually tested and they were positive, and then how are they feeling? What can they do? And that kind of slow return to activity, similar to what we do for the concussion stuff, of what can you handle? How does that feel? Let's go up to the next step. We've talked with our cardiologist and our pediatric cardiologist, and just the plan that Dr. Stites was talking about, where indicated what's the testing that needs to be done to make sure, as far as we know, that these kids are safe going back into full activity. But it's one where I think the same, it's a team sport with those patients, student athletes. You've got to be honest about how you feel and how you're tolerating that increased activity, and it is not the time to tough it out. You know, say, I'll just work through this and not tell anybody. It's going to be really important as we work to understand what this whole heart involvement with COVID is, that they're reporting how they're doing and play by the rules. And then on our side, be working with them and our specialists to make sure they get the appropriate testing to make sure they're safe.
Yeah, I think what we can say is COVID is different than any other virus, and that's what has scared all of us a little bit. But if a kid has any, I had one of my patients in the clinic yesterday and had expressed a little bit of shortness of breath post-COVID. And I have a lung clinic, and my patients have shortness of breath at baseline. And so but when they feel a little worse or they're not right, then it's like, okay, well, we got to do some additional work, because it's probably not safe for you to go back without knowing that. And I think that's just the important consideration. If you start having any symptoms, you got to be evaluated. Okay, Jill, time for one or two more questions.
Okay, Chrissy had a real quick follow-up to the discussion. Does age matter with the risk for myocarditis? What was the study?
Yeah, we don't know.
Adults?
We just don't know right now.
All right.
And I think that's where we just have to leave it. It is a study out of Germany, but it's also, we are seeing preliminary results in athletes that suggest there is a percentage of college athletes after COVID who have myocarditis. Now, MRI is so sensitive, we don't know exactly what that means, and we don't know if it means you're at risk for sudden death or not, and that's part of what we don't know. So
Michelle had it. Oh, sorry.
Ages. No, I was going to say all ages.
Yep. All right. Michelle has a friend whose daughter tested positive. The county health department said it's a low viral load. What does that mean? Is that good?
Mm-hmm. Yeah, that's interesting that the county health department said it's a low viral load. That's a little unusual. Okay, Dana, you want to try that one?
I mean, there are some reports out there and published studies about maybe higher viral load especially if you're in, say, critically ill in the ICU, maybe higher risk of complications.
But to do a viral load, you got to do a blood test.
That's
You really
right.
can't do that successfully off a nasal swab.
So-
if it's that means somebody at a county did a blood test for a viral load. That's an unusual
Well,
thing.
or I don't know if they're using cycle threshold, how many
Yeah.
times.
Cycle
It's really
thresholds,
difficult to
yeah.
say. I don't think in this case that it's really significant at that point. You still have been diagnosed. If you have little to no symptoms, that's great. We want to continue that. Stay isolated and get well. Certainly, if you think you are having symptoms and they are progressing, then seek medical care.
And if you're 10
But-
days out, you may have a low viral load because you're further
yeah,
out.
absolutely.
You're not kind of pregnant, you don't kind of have COVID. So, it's just,
That's a good answer.
That may be the quote of the
That's
day. Last question, and I'm kind of morphing. A lot of people are asking, did people miss their wellness exams and their sports exams? Did they miss their vaccinations? And then Jessica adds on, she's a new patient of ours. And she's coming to the campus for the first time and asking, what do I do to protect myself? What should I expect? So can you just kind of
Okay.
speak to all
Take
of that?
part, and then we'll jump on this.
okay, so I'd say we've worked with our clinic managers and nurse managers to really streamline the process, so as much as possible, people being checked when they met at the front door of any facility, checked to make sure that they're supposed to be there, that they are well enough to come in.
They got a mask.
They have a mask, and then in the clinics, really working to get people, really tried to avoid the idea of waiting room as much as possible, so getting people into rooms as quickly as we can, getting all their stuff done there, and then trying to get them checked out without stopping back in the waiting room. So really cutting down their contact and travel time and exposures within the clinic. So if anything, right now, I believe our clinics are a safer environment than they were last year at this time. So we want people to be coming in, keeping up on all that well care, whether it's child, adolescent, or adult, is crucial. Getting those vaccinations all caught up to date. We'll do everything we can to make it a safe environment and make them feel comfortable coming in here, because we believe we can do a really good job at that.
And so, Dana, we contact trace anybody who comes in
Yeah.
that's been positive. Same thing's true for patients and staff.
Yep.
Don't think we're finding a lot of transmission inside our
No,
our
luckily,
walls.
yep.
We've been really good about that.
Patient to healthcare worker or healthcare worker to patient. So like we had said, from day one, we had that shutdown here at the health system so we could develop our processes better for protecting our patients and our employees. Those have evolved even more greatly, just to what you have been speaking about.
All right. So, David, final thoughts today?
I'm just going to comment on that too. The sports physical. Oh, did you say David or Dana? I'm sorry.
But you,
David
Smith, Dr. Smith.
Yeah.
Call a page,
Yeah,
Dr.
okay.
Smith.
Yeah. So thank you. So a couple months ago, we actually weighed in on should we possibly waive the requirement for a sports physical this year so that we could potentially keep them out of offices and stuff. And unanimously, we decided that it's important. Why should the sports physical go away? And it gives the opportunity for the physician and the parent and the student athlete to talk about the issues we just talked about. We have a recommended questionnaire that now is attached to the sports physical as they come back that goes through the pertinent questions on, have you been exposed? Have you had COVID? Have you been, any symptoms? And we want them to answer that questionnaire so that when they see Dr. Lauer and other physicians on the front line for these physicals, they have that opportunity to educate. That's what this sports physical has been about forever, is the opportunity to educate people on the health and safety of the athlete as they go to sports. So I generally say there's a risk and benefit to everything we do. If the risk outweighs the benefit, we pause, we really step back, we get more evidence, and we then move on that direction. If the benefit outweighs the risk, then we pause, we think about it, we move forward. There's a huge benefit to being active in sports, activities, and exercise, and we cannot continue to live in fear. We just have to get smarter and smarter, and we're going to know more next week. This roller coaster I talked about earlier will continue to be a roller coaster for a little bit, but emotion is the deadly enemy of clear thinking, so let's not emotions take over. Let's be very clear on our thought processes.
I love that. Well said. Thank you.
I'd say, just continue on the analogy of the day, this is a team sport going forward. We know example after example when groups of people follow the isolation rules, the hand washing, masks, social distancing, we can keep this virus under control. So if people want their kids back in school, they want to be able to go to work, they want to be able to participate in sports, everybody's got to get on the train on this and play along with all these rules. It's the only way we're going to get this under control until there's a vaccine.
Yeah, just to echo your points, nobody wants even just a little bit of the Rona or a touch of the Rona. We don't want any of the Rona. Continue to do those things that we've talked about. We heard Emmy earlier today. You know, she's going back to school. We need to decrease the spread of this as much as possible. We've already seen Shawnee Mission School District now go to all online. It is nice to get our kids back into school in the safe environment, but we really need to stop the spread as much as possible. So it's not meeting in large groups more than 10. It is wearing your masks. It is doing the hand washing, doing all those things that we've talked about now. And as we move forward, hopefully we can get back into the schools, and hopefully no more schools will have to go to all online. But until that happens, we need to keep doing those things that we've talked about.
Yeah, it's been a great program this morning, folks. Thank you all for being here. David, as always, it's a pleasure to have you. Steve, same thing. Hawkeye, always here. So a couple of quick notes about tomorrow. We have some pretty cool guests. The Archbishop Joseph Fred Nauman, who's the Archdiocese of Kansas City in Kansas, and Bishop Susan, I think it's Candia, the Central State Synod of the Evangelical Lutheran Church in America will join us. They're going to be talking about staying resilient during these stressful times and committing to a cause. Also, please send us your photos of wearing the mask and social distancing to keep each other safe. We're going to do some kind of fun with these. We'll talk about that getting closer to the Labor Day weekend. So send those to our Facebook or email us at medicalnewsnetwork@kmc.edu. Then we've got, of course, a few things here at the very end that we want to show you. A video with Scott and Shannon. I'm not going to say their last name correctly, so I'm just going to say Scott Brugi. I'm just going to say Scott and Shannon. As that video ends, I just want you to take these thoughts going forward with you. You know, you don't need a 3rd and 15 WASP play. It is not a desperation heave. Actually, it wasn't a heave. It was a pretty darn good pass. But you don't need a WASP. What you need is a mask. Remember what Tyrann Mathieu always does when he's back there in the secondary? What does he tell you to do? Play smart. Remember, there's still no place like home, especially with a mask on.
I'd like to introduce Shannon and Scott Brugi. They're from Tonganoxie, Kansas, and they've got quite a story to tell.
It was 30 days. I was quarantined from the time we were notified that he was positive, and obviously the longest days were dropping him off at the hospital and being told to go home, and that they would reach out to me, and that phone call that your husband is on a ventilator in ICU and you can't be there with them is just gut-wrenching. It still gets a reaction out of me, and I called the hospital every day and they were absolutely wonderful. I checked in at every 12-hour shift and got updates, but all I could do was be Scott's voice and reach out to his family, and that's all I did every day was checking in and calling. We actually had a smile through a vent tube that the doctor said, I don't know that I've ever seen this, but he heard my voice and he smiled. He doesn't remember it, but that was the best day.
And I think in the March and April timeframe, the quarantine timeframe, I think a lot of families looked at that as something easy. But I know as summer months, we've seen it ourselves, and within our immediate family, it gets a little more relaxed. And I think everyone just has to understand that we're not through this, and the numbers show that. And at some point, the laws of averages will say you may have this, and God forbid that anyone has to go through what I went through. Again, I consider myself lucky. I know the statistics weren't with me on coming off that ventilator, but again, I'd hate for someone to have to go through that and unfortunately have to pass away from that.